Hello, everyone. Again, my name is Owen Lay. I will be the moderator for today's Continuing the Conversation webinar. Thank you for joining us. Thank you for joining the Fielding School of Public Health in our series discussing issues critical to public health. We're joined today by Dr. Wang, and I just want to let you know, if you have any questions during Dr. Wang's talk, please feel free to post it in the chat window. We will be having a Q&A at the end of the session, and I'll be keeping track of the questions so that we can pose them to her at the end. Okay, so let's start. First, a little introduction. Nearly 2/3 of all infants born in Los Angeles County are enrolled in the Special Supplemental Nutrition Program for Women, Infants, and Children, or WIC, and it serves pregnant, breastfeeding, and postpartum women and children up to 5 years old from low-income families. Public Health Foundation Enterprises WIC, the largest local agency WIC program in the country, with support from First 5 LA, maintains a large geocoded database of all WIC participants in Los Angeles County. This webinar will discuss collaborations between the UCLA Fielding School of Public Health and PHFE-WIC, with a focus on the NIH-funded Early Childhood Obesity Systems Science Study to evaluate the effectiveness of programs and policies on childhood obesity using a systems science approach. Again, if you have a question during or after the lecture, simply type it into the chat field at the bottom of your chat window. And Dr. Wang, let's take it away.
Okay, good afternoon, everyone. Thank you so much for joining this webinar, and thank you, Owen, for the introduction. I am a public health nutritionist by training, and my research has focused mostly on child obesity, particularly in children from low-income households. What this means is addressing social disparities in child obesity has required an interdisciplinary approach and collaborations with community agencies that deliver services directly. So in the next few minutes or so, in the next 40 minutes or so, I would like to share with you our collaborations with Los Angeles-based PHFE-WIC, which serves low-income pregnant and postpartum women and children up to the age of 5 who are at nutritional risk, as Owen has mentioned. So I'm going to talk a little bit more about WIC later. Some of you may be very familiar with it and others not so. But let me first take a few minutes to review trends in child obesity. Okay, child obesity rates have more than doubled over the past 3 decades, and this has been a hot topic in the news as the nation tries to grapple with rates that have reached over 20%. And as you can see here, child obesity rates in California are not among the highest in the country, but they're significantly higher than in many parts of the country, averaging about 15% in 2011. Note that obesity in children is defined as having a body mass index, or BMI, or weight over height squared, at or above the 95th percentile of the sex-specific CDC BMI for age growth reference curves. Also note that there is another category of child weight status, which is referred to as overweight, and children with a BMI at or above the 85th percentile are considered overweight. So together in California, we have about 30% of children who are overweight and obese. So now let's take a look at obesity prevalence trends by age group. What we see here is that obesity prevalence rates have remained relatively unchanged in the past decade for older children, but not for younger children. Analyzing data from the National Health and Nutrition Examination Survey, National Survey of Nutrition and Health, Cynthia Ogden and her colleagues from CDC's National Center for Health Statistics recently reported a 40% decrease in the prevalence of obesity among school-age children, from 13.9% in 2003 and 4 to 8.4% in 2011 to 2012. Now, these findings cause considerable stir, especially in places such as Los Angeles County, where child obesity continues to be prevalent in some subgroups. So in this webinar, I'm going to present some of our research on obesity in preschool-age children in Los Angeles County, made possible by our collaborations with PHFE-WIC. We're asking questions such as, have obesity rates in school-age children decreased in LA County? If so, is the decrease uniform across LA LA County, and if the decrease in obesity prevalence is not seen uniformly across LA County, then why are some communities seeing an increasing trend while others are seeing a decreasing trend? Before you get too excited about this, I just want to preface this by saying that this is continuing research, so I will actually be talking about the study that we're doing rather than be presenting final results at this stage, since we don't have current results at the moment. Now, before I launch into a presentation of our work with WIC, I'd like to explain what WIC is for the benefit of some of you. So those of you who are really familiar with WIC, you could take a few minutes off at the moment. But before I do that, I want to kind of briefly attempt to put in context the value of addressing obesity in this very, very young group of children. Why do we want to intervene so early in life? First of all, we know that there are severe medical consequences of obesity, of childhood obesity. Obese children are more likely to suffer from chronic diseases such as diabetes, heart disease, and cancer later in life. We also know now that obese children suffer from conditions used to be seen only in adulthood. High blood pressure, high cholesterol, and type 2 diabetes, to name a few. And in addition, non-alcoholic fatty liver disease affects about 5% of American children, and it is estimated that more than half of obese children have non-alcoholic fatty liver disease. Another reason that it is important to address obesity early in life is obesity tracks in childhood, tracks into adulthood. For example, Whitaker and colleagues, using height and weight measurements abstracted from the records of 854 subjects born at a health maintenance organization in Washington state, reported that the odds of overweight and obese school-aged preschool children becoming obese as adults are nearly 5 times that of normal weight children. More recently, Wang and Liu observed that rapid weight gain during infancy is associated with higher odds of obesity later in life. It is also important to note that while California has seen decreases in preschool-age child obesity, it still has one of the highest rates of preschool-age child obesity in the country. So these slides show data from CDC's Pediatric Nutrition Surveillance System, which collects data from low-income children through the WIC program. So in this next slide, we show trends in obesity rates among low-income preschool-age children in LA County, noting that rates are highest for Hispanic children. Oops. Do I need to go back? Okay, sorry, I think we had a slight technical difficulty there. So I was just saying that it is important to note that child obesity rates in preschool-age children in California are among the highest in the country, and that here in LA County, we have an administrative WIC database that has been tracking preschool-age child obesity rates from about 2003 onwards. So what is WIC? I'd like to talk a little bit about WIC first, because most of our work is based on this data set that's being collected by PHFE-WIC here in LA County. WIC is a Special Supplemental Nutrition Program for women, infants, and children. It serves pregnant women, postpartum women, infants, and children up to age 5 who are low income and at nutritional risk. And it provides nutritious foods, nutrition education, breastfeeding support, and referrals to healthcare and other services. WIC is funded by USDA, and it is the second largest federal nutrition assistance program in the country after the Food Stamps program, or what is now called SNAP. It serves 8.6 million participants nationwide and 1.4 million participants in California. In LA County, WIC serves about 500,000 individuals, 91% of eligible infants, 69% of all infants, and 63% of 0 to 4-year-olds. So how does WIC work? Participants are certified about once every 12 months, and they receive health screenings. During these screenings, they provide height and weight measurements. They receive nutrition education and also vouchers for healthy foods. In 2009, there was a historic change in the WIC food packages. This increased access to fruits and vegetables, whole grains, low-fat dairy foods, marking the first comprehensive revisions to the WIC food packages since 1980. Some of the scientific work that provided evidence to show that providing food vouchers for fruits and vegetables would lead to a sustainable increase in fruit and vegetable consumption was done here at UCLA by Drs. Dina Herman and Dr. Gail Harrison in collaboration with PHFE-WIC. Research on the impact of this change in the food packages is emerging. Several studies have shown that it has led to changes in the landscape of available foods in low-income neighborhoods in Philadelphia and Connecticut. And prior to my joining UCLA in 2008, I had conducted one of the first studies in California on the food environment and its effects on obesity with Marilyn Winkleby at Stanford. And within months of my joining UCLA, a first-time fortuitous meeting with Dr. Shannon Whaley, the Director of Research and Evaluation at PHFE-WIC, quickly led to a collaboration funded by the American Heart Association. And this collaboration allowed us to examine the effects of the neighborhood environment on preschool-age child obesity in LA County. Let me briefly say a little bit about PHFE-WIC, who's our main collaborator here. In LA County, there are 7 local agency WIC programs, with PHFE-WIC being one of them. And they serve about 500,000 individuals currently. First 5 LA has been funding the establishment and the maintenance of this large database that harnesses data from all of these WIC programs in LA County. And so this rather unique database that contains data on every WIC child in LA County from about 2002 to 2003 onwards contains data such as height and weight, obviously, but also on prematurity, birth weight, mother's height and weight, breastfeeding rates, and most importantly, besides having the socio-demographic information, it has data on the census tract of residents of every WIC family. So what this meant was it allowed us to link all of these geographic information on each child to geographic information such as median income of the neighborhood in which the kid lives, as well as on the food environment. Another part of this effort that PHFE-WIC has made is the LA County WIC surveys. And these surveys are conducted once every 3 years of a randomly selected sample of about 5,000 to 6,000 participants. And they answer questions. It's a telephone survey. And they answer questions such as on topics such as food and sugar, sweetened beverage intake, breastfeeding practices, household food security, child care and preschool utilization patterns, home literacy practices, maternal emotional well-being, and so forth. So if you're interested in what the kinds of data that this survey collects, you can find the questionnaire at this website at phfewic.org. Okay. So all of these data are maintained by PHFE-WIC, again, here in LA County. And with collaborations, through our collaborations with them, we have actually worked on numerous small and larger studies, which I don't have time to go through. Some of this work has been published, and I have listed some of our peer-reviewed publications here for those of you who are interested in going through them. And I'm happy to answer any questions that you might have about these. So moving along, one of our most recent collaborations with PHFE-WIC, funded by First 5 LA, was to map obesity trends by neighborhood. As you can see in this slide here, between 2003 and 2009, there's been an increase in child obesity rates, followed by a decrease from 2009 to 2011 in LA County. So the question then is this decrease uniform across all neighborhoods, or did it vary by neighborhood? This is a map that we created through this study that we conducted recently. And as you can see here, these are all census tracts. And the green tracts show those neighborhoods which we define by census tracts, not necessarily the best definition of neighborhood, but it was a way for us to link all of these data to census data to help us understand what these neighborhoods are like. And these green census tracts here, these are tracts where we've been seeing a decreasing trend in obesity rates between 2002 and 2011. And the red census tracts are the ones where we've been seeing an increase between 2002 and 2011. So based on this map, it kind of asked this map actually raised a lot of questions. And what we felt we needed to know was what was causing the rates to decrease overall. Why were these trends varying by neighborhood? What was it about neighborhoods that might have affected the trends? Were there interventions in these neighborhoods that led to decreases when there were decreases? And which were the interventions that were effective? So, as an example of the interventions that have been taking place in LA County, there's been a lot of effort to address childhood obesity in LA County and California generally. Examples are listed here. Many of you are probably familiar with the HEAC initiative. This is a Healthy Eating and Active Communities initiative that was funded by the California Endowment in the mid-2000s. And then there have been other efforts that have been funded by Kaiser Permanente, this California Project Lean, and of course First Five. And then there have been many community transformation grants that have been funneled through the LA County Department of Public Health and funded by CDC. And of course at the national level in 2009, as I indicated earlier, there was this historic change in the food package. So this confluence of factors has allowed us to think about answering these questions by developing a rather ambitious research study to answer questions such as what intervention approaches or combination of intervention approaches are effective in decreasing child obesity rates, and what are the interactions between these intervention approaches and the context in which they were implemented. This led to the development of the Early Childhood Obesity System Science Study. We call it ECOSYS. It was funded by the Eunice Kennedy Shriver National Institute of Child Health and Human Development at NIH in 2013. With me and Mike Pralip here, my colleague, as principal investigators. And I kind of want to mention that this study could not have been developed without partnerships with various organizations. And here we've listed all of our partnering agencies and the investigators here because it was truly a very interdisciplinary study that required expertise from different disciplines as well as from different organizations. So the aims of this study were to identify, or are to identify, obesity-related interventions and policies in LA County that have taken place since 2003. So keeping in mind that we have all of this data from the data mining project that's been maintained by PHFE-WIC, so we thought we'd be able to link these interventions and policies to these changing trends in child obesity prevalence, given the fact that all the addresses of WIC families in LA County have been geocoded down to the census tract level. And the fact that through our earlier study, we already have data describing the neighborhood environments of these families. Another study aim was to develop and validate community-level intervention, a community-level intervention dose index. So the idea was WIC families are probably exposed to the WIC program, but also to other types of interventions that were taking place. How do we assess or how do we measure the effects of a combination of the exposures to these different interventions? Another study aims to estimate obesity trends in preschool age WIC participants, which we've actually already done. And then the fourth study aim was to evaluate relationships between preschool age obesity trends and community-level intervention dose using multi-level modeling, as well as causal inference methods. And the last study aim is the one that's got many of us very excited. It is a new approach in public health. It's been used in other fields. It's only in the past 5 to 10 years that it's beginning to be used to address chronic diseases and chronic health conditions in the public health field. And this is a system science approach. And in particular, we are using one approach of it called agent-based modeling. And what it does is it uses computational modeling to allow us to explore dynamic interactions, feedback mechanisms, and also the effectiveness of policies. So the emergence of system science, well, I think it's gotten to be very important in this field because public health issues, as you know, are very complex. There are often multiple factors that interact with each other, obesity clearly being one of the prime examples. And what it does is it allows us to address all of these complex issues through computational modeling that is applied to large data sets. And it is because we have this large data set that has been maintained by PHFE-WIC and supported by First 5 LA over the past decade or so that has allowed us to even conceive of doing this study. So the system science approach, as I mentioned earlier, allows us to explore these dynamic interactions among a set of what we call agents or factors. In this case, we're thinking about public health agencies, the interventions in the community, any local policies that have taken place in the local community, as well as the context of the neighborhood environments in which the child lives. And what we hope to do with this is to use system science to allow us to predict obesity rates by looking at all of these interactions. Sorry, it's a bit challenged there technically. To allow us to look at all of these interactions and predict obesity patterns so that it will give us a better sense of what kinds of interventions were the most effective within the context of certain neighborhoods. So, for example, with a primarily education-based, a traditional kind of nutrition education program, be effective in a neighborhood where, be more effective in a neighborhood where environmental changes have been taking place to, say, neighborhood grocery stores as well as to parks. So for our study, what we have is data, and again, I mentioned earlier, it was a confluence of factors. We had this data from the WIC data mining project that we were able to link to all of these environmental data through the earlier collaboration that we had that was funded by the American Heart Association. And then we have been partnering with LA County Department of Public Health that through its efforts, through its community transformation grants and other efforts, have been collecting data on interventions that have been taking place in LA County. Granted, what we're trying to do is to get a handle of all kinds of interventions that have been taking place in LA County since 2002 that the LA County Department of Public Health knows about, as well as others. And so we will be conducting key informant interviews to help us get a better handle of all of the interventions that have been taking place in LA County that might have an impact on early childhood obesity. We're actually interested not only in nutrition and physical activity interventions, but any kind of intervention that might have an impact on food and nutrition, physical activity that might affect childhood obesity risk directly or indirectly. This clearly is a very ambitious project, and what we have done is we've put together 2 work groups to try to help us develop this dose of exposure to community interventions. We needed to first identify relevant domains and constructs, and the first work group 2 has actually recently completed its task of identifying these relevant domains and constructs, and these were physical resources, social resources, capacity development, programs and policies, and context. And I see some of you who are in this room right now have actually been team foreman interviews for this, and I want to thank you very much for your input in helping us identify these domains and constructs. Now, work group 2 has started work, and its task is to operationalize these constructs that work group 1 put together, and to develop data collection instruments and protocols. And currently, we are in the process of developing, of operationalizing these constructs, developing relevant questionnaires and the data collection tools. So these are work group members. Work group 1, we have Dr. Ari here at UCLA. We have members from the LA County Department of Public Health, Ricardo Brasuda Davila, Brenda Robles, and Tony Klo. And then the Kaiser Permanente, we have Mernaz Davudi, and see, at Berkeley we had Suzanne Razan, and we have Matt Sharp from CFPA, and Sally Yoshida from Samuel Center. And then, of course, investigators Shannon Whaley, myself, and Mike Pralip, and also Wendy Slusser from UCLA have been a part of this work group. Work group 2 members, we have representation from the LA County Department of Public Health, as well as Edmund Cito from the University of Washington, and also Shannon Whaley from PHFE-WIC. So this is our project timeline. We are currently here in kind of somewhat the beginning of year 2, where we're starting to actually just develop the data collection tools. We're a little bit behind. We're planning to collect data in the next 3 to 4 months, and then in the following year, year 3 and year 4, we will be putting all of these data sets together to apply traditional statistical type analyses, as well as causal inference methods, to kind of look at associations. And then using that data, we'll be applying system science methods and applying a program called AnyLogic to help us do the computational modeling that we hope will allow us to identify which intervention approaches have been the most effective. And in our final year, what we hope to do is to be able to disseminate these findings with the input of the community, and we're hoping to be able to develop an interactive website that would provide information to program planners at the local level that would help them with program planning. So I want to acknowledge all of the people who have supported us. This very ambitious study couldn't even have been conceived with all of the initial work that had been done by PHFE-WIC with the support of First 5 LA. And also, I'd like to thank the American Heart Association for supporting one of our initial studies on neighborhood environments and linking those to the WIC data sets. And also all of the help that has been provided us and the support from the LA County Department of Public Health, particularly Tony Klo, Brenda Robles, Margaret Shi, and Paul Simon, who have worked with us very closely to develop the proposal. So I want to thank all of you, and we have quite a bit of time for questions and answers, and I'll be happy to answer them. So a quote that I love from the book Consilience by Edward O. Wilson that kind of wraps all of this up. He said, "We are drowning in information while starving for wisdom. The world henceforth will be run by synthesizers, people able to put together the right information at the right time, think critically about it, and make important choices wisely." So I think we're open now. We have quite a bit of time for questions and answers, and I'll be happy to take any questions that you have.
All right, Dr. Wang, thank you very much for that informative talk. Again, as she said, if you have a question, please type it into the field at the bottom of your chat window on your screen, and we'll pass it along, and she'll be able to see it as well. But Dr. Wang, let me start things off. Can you talk about how easy or difficult it was to actually begin this collaboration with PHFE-WIC?
That's a great question. I started off by saying that I am trained in public health nutrition, not quite trained in the social sciences. So I actually come from a laboratory science background initially. And so trying to put together an interdisciplinary study often means bringing people who have been trained differently to think differently. And some of the challenges, I think, is just getting people to realize that we have common values, common goals. We sometimes use different professional jargon. We sometimes think we're arguing about something when we're actually talking about the same thing. It's just that we're thinking about the topic from a very different perspective. So it's been, a lot of, I guess, for me, it's been sitting in on all different kinds of groups and realizing after a while, that it takes patience, it takes a lot of listening to kind of help bring together a group of people who all have the same shared values and interests, but trained to kind of look at the problem differently. And with this particular group, I just can't say how fortunate I have been to have run and to have met with all of these individuals who were able to have this shared vision. And I think I want to say I've been very, very fortunate. It didn't take me that long after coming to LA to kind of find all of these people who were willing to go along with some of the relatively crazy ideas that we had at the beginning.
Dr. Wang, I know that you had mentioned that part of this, the scope of this, the part of the reason it's ambitious is because you're looking at so much data, and you're also looking for interventions that are maybe beyond what people are normally, would normally consider when considering issues of child obesity. And with the caveat that, like as you said at the beginning, that this is still an ongoing study and ongoing research project. Is there anything that you've seen so far that kind of strikes you as surprising or confirms some of the things that we may already know?
I'm not sure if we are actually still in the very initial stages of collecting data, but I think in some of our earlier conversations, we have actually been talking to a lot of people who have been incredibly kind in sharing with us their time. We've been testing interview guides and just talking to people, even developing all of those domains and constructs. What I think struck me was how far we have progressed in terms of thinking about obesity. The number of people I've talked to who come from all kinds of backgrounds, not necessarily nutrition, some from program planning, some from the field of physical activity, some more from a kind of a healthcare administration background, but everyone was very open to the idea that trying to address child obesity, that we need to kind of go beyond talking about, and we need to go beyond nutrition education and getting kids to be physically active. Not to downplay that. I think those are critical things. They're necessary, but the question is whether they're adequate. And so what I think California has been very progressive in this regard, I think, compared to many other states, that about 8-10 years ago, we started thinking about changing the environment. We started thinking about trying to increase access to fruits and vegetables. Some of the early efforts took place right here in LA County, up in Oakland, in Northern California. And you know, people have made mistakes, we've all made mistakes, but we've all been working towards that same goal. So today, I think we know quite a bit more. We still have a long way to go about how to change that food environment, or at least what not to do, and to try to increase access to fruits and vegetables. I want to mention too that that my colleague, Dr. Mike Prevalence here, has been leading another NIH-funded study in LA, in East LA, where they have been working with the communities to get local markets to carry more fruits and vegetables. But beyond that, there's also addressing things like crime. If we want to increase physical activity, we need to not only have parks available, but we have to make them safe. So that means addressing things like gang violence, things that are usually outside the realm of people who do nutrition work. And so I guess that was the thing that surprised me the most, how open people were to all of these ideas and how supportive they have been of this project.
Well, it does look like we have a few questions from our participants. Jocelyn here says, will you be including data and results from past obesity prevention programs? If yes, how far back will you go? Yeah, this is what we would love to do as we're trying to gather all of these data. Keep in mind there have been a lot of interventions that have been taking place, big and small, and some have been evaluated to a greater extent than others. Some have qualitative data, some have quantitative data. And so we're trying to collect all of those types of data through key informant interviews, and we're going to be using a snowballing approach. So if anyone in this room right now has access to those kinds of data, I would so appreciate hearing from you, and we would love to do a key informant interview with you. So we're going back as far as 2002. That's when PHFE-WIC started collecting data. But if there's any intervention that took place even before that that kind of continued past 2002, we would be interested to know about those too. All right, we have two questions from Luke. The first one is there a group of potential collaborators with whom you have not yet gained traction, but whom you think can be a key contributor to solving the child obesity crisis in LA County?
I am sure there are many other groups that we would love to work with. I think when we get to the 5th year, particularly when we're disseminating data, or maybe even up to the 4th year, we would be wanting to try to reach out to more groups who, I'm thinking about groups that would be involved in policy decision making, for example, at the different levels. What I haven't mentioned, I think, in this conversation, I haven't talked much about the socio-ecological model, which is a theoretical framework that kind of helps shape the way we've been looking at this. And that means looking at interventions at all of those levels, from the individual and family level to the school and community level and the policy level.
And the second question, are there model communities in other parts of the state or the country who have fixed issues of crime and easy access to nutritious foods from whom LA County can learn and adopt best practices?
There have been quite a few efforts that have taken place in I think in inner city areas, in New York and Philadelphia, and then there's been also the study out of Tufts University where I've kind of forgotten the name, Shapeville, I think, where they've been trying to involve people at all of groups at every level to kind of address all of these broader issues beyond education. beyond individual level education.
I'm curious for maybe, I think we have a lot of academic experts here, but for maybe the lay people in the crowd, can you talk a little bit more about what it takes to use a system science approach to do these kind of evaluations?
Yes. System science comes more from the field. It's been used in other disciplines, from business to the social sciences. And it comes more from computational modeling. It requires large data sets. I wouldn't claim myself to be a system science expert, but we do work with others who have come from those fields. In particular, currently we're working with Dr. Osgood from the University of Saskatchewan. I don't know this for a fact, but I've joked with him that he's probably the only professor I know who's got an appointment in computer science and in community health. So trying to wrap our minds around all of this computational modeling has been quite challenging, and we've done some training here. We've kind of sent our staff from all different levels just to kind of be exposed to this rather, I want to say new, but it's really only new in our field here, approach to using data. And it's kind of looking at all of these dynamic interactions, doing a lot of simulations. And with all of these simulations, you kind of keep repeating them. At some point, it allows us to look at patterns that will help us predict some kind of outcome, in this case, childhood obesity. I hope that helps a little bit.
Absolutely. So I think you talked a little bit about this, about year 5 collaborations, maybe with policymakers and things, but how do you plan, I guess, to use these results in the future? Is there anything else you can tell us about that?
I think, yeah, I mentioned earlier that what we're hoping to, when we have our results, we'd like to do data dissemination in a way that involves all of the communities. But one idea that has been shared with us is to try to develop some kind of an interactive platform, an online interactive platform. And the vision right now, I'm a little bit hesitant about talking about it, only because it is still kind of a vision and it's not very clear in my head at this moment how it's going to work. But we're thinking about having a platform where people can go in and, for example, they could say, put in statistics about their own community. You know, the percent who are poor, percent of kids under the age of 5, percent participating in WIC, etc. And then it would draw from this database that we hope we will have, but I guess the challenge is to update it continuously about the food environment, physical activity, etc. And then to kind of identify somewhat similar communities that have implemented interventions that have worked, to help so as to help program planners and decision makers at the local level to kind of decide make decisions around what kinds of interventions might be the most effective within their individual context or setting. So that's clearly going to be very costly. That was not written into our NIH proposal. But we've been thinking about it, and we've got a few years to kind of work towards that. That would involve collaborations with the health department, with PHFE-WIC, and probably a lot more other agencies to kind of pull this off.
Because of, this is a question for me, I'm curious, because of the way it's geocoded, is it possible, it sounds like it's possible to scale the scope of the study to different communities within LA County. Is it also possible to extrapolate some of the data down the line to something wider than just our local area here?
When you say local area, do you mean LA County? Right. Yeah, I think that would be the hope. I think what's so unique about LA County is we know it's sprawling, it's very diverse, but it also, I think we have the advantage, let me back up a little bit. To do the kind of what we do with neighborhood environments, one of the things we have to do is to try to separate the independent defects at what we call the individual level, at the kid level, from what's going on in the neighborhoods. Now, to do that, we need to have data. We need to have kids who live in different types of neighborhoods. So, for example, if all of the poor kids live in only poor neighborhoods, and all of the the kids who are more middle and high income live in the same kinds of neighborhoods, then we would be incredibly challenged in trying to do this kind of study. So what we have here in LA County is, yes, we have a lot of poor neighborhoods, but we also have neighborhoods that are not so poor, and then we have not so poor neighborhoods that are right next door to wealthier neighborhoods. And all of this has spillover effects that allows us to tease out all of these, to tease out the independent individual level effects from the environmental effects. And in the map that I showed earlier, with all of those decreasing and increasing trends, if you're able to zoom in, you'll be able to see that there are actually clusters of neighborhoods where you have decreasing and increasing trends, obesity trends, that are right next to each other. And this provides an incredible opportunity for us to try to understand what's going on at both the individual level, or the child level, and at the environmental neighborhood level. And if you're able to tease some of those effects out, I think some of those effects at least would have implications for areas outside of LA County.
All right. Well, I want to open it up still to the audience, and if you have any other questions, please feel free to put it in the chat window. Otherwise, I'm going to ask you one more question, Dr. Wang. Is do you have any kind of other intervention projects that you're planning with WIC that you can talk about?
Yeah. We have a few ideas in the works. We're thinking about doing, developing parenting programs with PHFE-WIC, but also acknowledging the lack of access to healthy foods in some of those communities. And one idea is to work with the agencies that what we call the CSA, Community Supported Agriculture groups, to try to bring healthier foods to some of these communities, while also working on education and parenting, on developing parenting skills. Another idea has been to try to figure out how to coordinate the services of PHFE-WIC, of WIC programs with what's going on in preschool childcare centers, because the idea is if families are getting the same kinds of messages around health, physical activity, and nutrition from different places, from WIC, from childcare, maybe even from K-12 schools, if they have older kids, that would kind of reinforce these messages. And as we kind of work on environmental policies, this would be maybe be more effective in trying to reduce child obesity.
All right. Well, thank you very much, Dr. Wang, for joining us today, and thank you everybody else for joining us for this Continuing the Conversation webinar. It was very informative. Thank you so much for this wonderful talk and for your great questions. Please join us on Wednesday, February 11th, when we continue the conversation with Dr. Brennan Spiegel, who will discuss disease monitoring and mobile health in a talk titled The Future of Disease Monitoring, Mobile Health, Social Media, and wearable sensor applications. Now, if you missed any of our previous webinar, you can always go to the Fielding School of Public Health's website. That's an easy URL, ph.ucla.edu. They're all archived there, except for this one. Please allow a few days for this one to post. Thank you again for joining us, and we hope to see you next time.
Thank you, Owen, and thank you, everyone.